The global population is almost approaching 2 billion, and out of which at least 50% are at risk of at least one neglected tropical disease.
Of the Science Podcast with your girl, Anne with an E.
Every day across Africa, communities are confronting a silent crisis. Diseases that disable, stigmatize, and often go unnoticed. These are neglected tropical diseases, otherwise known as NTDs. These are illnesses that affect more than 1 billion people globally, most of them right here in our continent. NTDs disproportionately impact the world's poorest and most marginalized communities. In Africa, these diseases continue to perpetuate cycles of poverty, disability, stigma, and limited economic opportunity. However, these diseases receive minimal attention, research funding, or innovation. In 2025, the Drugs for Neglected Disease Initiative reminded the world that science and collaboration can end neglect. They called for renewed investment, innovation, and partnerships to eliminate NTDs. The recent elimination of sleeping sickness as a public health program in Guinea stands as living proof that progress is possible when political will, research, and coordinated strategic action come together. And that's what this episode is all about, illustrating the lived realities of communities affected by NTDs, the obstacles of progress, and the promise of African-led research, innovation, and advocacy. As you might all know, I'm your host, Chisa, and this is the 4th episode of our Rooted in Health series, a partnership in collaboration with Global Health Strategies, where we bring you the stories behind the science and the people driving change in the public health. Today, I'm joined by Michael Ofire, a public health practitioner and a program manager for NTDs at Amref Health Africa. Michael has spent years bridging epidemiology, community engagement, and policy, reminding us that science means little if it doesn't reach those who are most affected. Stay with us as we look at some of the work that he's involved in. Hello, Michael. Welcome to the show.
Thank you very much, Anne.
It is
excited. Thank you for inviting me.
Sure. It is such a pleasure to have you on the show and to get to know more about you and the work that you do. So before we get things started, could you briefly introduce yourself for our audiences who are listening?
Yeah, thank you very much, Anne. I work for Amref Health Africa in Kenya, and my main focus of work is on neglected tropical diseases, where we work with the government of Kenya towards addressing, or rather the journey to eliminating some of the priority neglected tropical diseases. That includes black fever, scientifically known as visceral leishmaniasis, elephantiasis, intestinal worms, and bilharzia. And out of all these, I've just mentioned 4, but in Kenya, we have 17 neglected tropical diseases. But largely in the world, the World Health Organization has classified 21 neglected tropical diseases. And in Africa, at least 20 of them have been documented to be present in the African continent. And of course, with other colleagues in other African countries, coordinated by the WHO Africa Regional Office, all of us focusing on supporting various countries to eliminate various neglected tropical diseases.
Fantastic. Thank you for that overview about you and also the work that you do. The topic of conversation today is neglected tropical diseases, or in short, NTDs. But for someone who's listening, you've given us what does that actually mean? What are neglected diseases? Why are they neglected? And why have they been classified into their own category as opposed to all the other diseases that we are familiar with?
Thank you very much, Anne. So, neglected tropical diseases are classified as neglected, one, just because of the first name, the neglect.
Hmm.
Um, they're largely given little attention in the global health sphere. They are largely underfunded. They mostly affect the poor. Most of them are chronic. It takes lengthy duration for someone to manifest with symptoms. And they are not diseases that, most of the policy makers, from where they sit, they don't perceive to be at risk of these diseases because of, the access to, better health services, access to interventions like, proper housing, etc., that kind of help prevent them from the risks of getting some of these neglected tropical diseases. And that's where they're really given little attention within the global health space.
Hmm.
And that's why they are called neglected tropical diseases. And the tropical part is because they are found within the tropical region of the world. For those that remember their geography classes, we have the Tropic of Cancer and the Tropic of Capricorn. So there are various, in the world, if you go back to the world map, you'll see areas where the tropical region lies. So Africa is part of it. And of course, we have the Indian subcontinent. We also have the South American region that lies within the tropical regions of the world.
That's pretty interesting. For an ordinary family in Kenya specifically, who, for example, AMREF works with, um, what does this burden of NTDs actually look like?
I'll maybe just paint a picture. The global population is almost approaching 2 billion,
Mm.
and out of which at least 50% are at risk of at least one neglected tropical disease. When we narrow down to our African continent, we actually contribute to 40% of the global burden of neglected tropical diseases. So if we were to do a calculation out of 1 billion people, we have at least 400 million people in Africa that are at risk of at least one neglected tropical diseases. And of course, this varies by country based on the in-country population. In Kenya, the population is almost approaching 60 million, and out of which approximately 50% of that population is at risk of one neglected tropical diseases. And as I had earlier mentioned, these diseases, in as much as they are predominantly found within the poorest of the poorest, we still have pockets within the urban areas, the urban poor, even the urban rich that kind of have, rather still suffer from some of these conditions. They are largely debilitating. They will lead to psychosocial distress, psychosocial issues. They will exacerbate the cycle of poverty because treating them is a bit expensive. And as I'd mentioned, some of them lead to permanent and lifelong disability, like elephantiasis, where lead to deformities either on the leg or the arms, and over time leads to lifelong disability. And some, of course, are very fatal, like visceral leishmaniasis. If left untreated, 95% at least of the cases will end up dying. And, some will lead to, like schistosomiasis that will maybe affect children. It will affect their neurological development and affect their academic performance. For women, it will affect their reproductive area within when they develop into female genital schistosomiasis. And at times, this is confused with cervical cancer, misdiagnosed, and it breaks families because of they are unable to have that physical contact for married couples, and at times these are some of the things that kind of break families. So the impact of neglected tropical diseases is huge because it not only affects the economy, it affects social lives, it affects livelihoods, it affects the development of children, and with that, they're unable to catch up with children that either in developed nations or within their countries that are privileged. So it kinds of help to expand the inequity, that is experienced within the communities that suffer from some of these diseases.
This is so heartbreaking. I mean, just hearing you explain these effects, and I'm also learning, and I'm sure even some of our listeners are learning the type of impact that it has at a social economic level as well. And we've seen, and you've mentioned already that these NTDs are persisting, and I'm sure there's been a lot of effort in the past, but what are some of the biggest barriers that are holding Africa back, specifically in really having targeted, or rather, yeah, targeted efforts, or real having like breakthroughs in treating these diseases?
First of all, before I talk about the barriers, I'd like to really celebrate Africa due to its rich diversity. We have people practicing different cultures. We have communities and countries that have minerals. Some are oil producing. Some the the main economic income is on agriculture, etc. So Africa is a very rich continent, and just going back to history, the first African country to actually gain independence was Ghana around 1957. But earlier on, Liberia, which moved from colonial rule around 1847. So, give or take, it would be right to say maybe it's the first African state that was freed from colonial rule. And just looking at other countries that are already classified as first world countries, like Singapore and Malaysia, between 1959 and 1965 is when they gained their independence. China around 1949. So essentially, most of these countries, they are as old as African nations or countries, but they also used to suffer from neglected tropical diseases if you dig deep in history. But there's something that they did differently that African countries can try and learn from to address the barriers that still hold Africa's progress towards addressing NTDs. One is the issue around inequity in development, because as I indicated, these are diseases of the poor, and the best way to get people or communities out of poverty is through economic development, ensuring education, access to markets for their products, minimizing the conflict that we see in most African countries, ensuring there's security for people to be able to do business, to be able to, do agriculture, work in, mining, farms, etc. And all this, once we try and improve the economic lives of Africans, then over time, an educated community will tend to learn and understand what are the reasons of some of their health conditions, including the neglected tropical diseases. At the systemic level, our leaders, and as we can see, most African countries right now, we can see citizens are really calling for accountability and wanting to elect patriotic leaders to kind of lead them. And so there's need to prioritize, health systems and not, look at health as an expenditure, but our leaders need to view it as a public good so that kind of they're able to invest in resilient health systems and largely looking at the primary healthcare level where services can easily be accessed by communities and in the principle of universal health coverage. So once they do that, then certain systems or other interventions like social behavior change communication, them understanding the need to change their way of life that is putting them at risk of some of these neglected tropical diseases will be addressed at that level when African governments kind of invest in health, strengthening health systems and prioritizing it, and looking at health as a public good that is also a catalyst for economic development because a sick population is unable to engage in meaningful economic productive activity. Lastly is around over-reliance of external funding for our health systems in Africa. Most of our governments, beyond salaries and the hardware, which is building hospitals, there's really very little to no investment when it comes to equipping, ensuring human resource that are fit for purpose are recruited, and as well as the software, which is around educating masses around their health, because the lack of knowledge is not, something that we can capitalize on, that it's the problem, but the educated that are sitting in governments at the apex of leadership, how can they use their knowledge and skills to try and sensitize their populace within their various countries? And I think if Africa tries to address all that, then it is going to accelerate the progress towards addressing the still high burden of neglected tropical diseases.
Just to further pull the string on the idea of the type of leadership that Africa needs, you did mention that one of the key factors is that we really focus on global global partnerships or funding, external funding, not coming from Africa. But what is some of the work that African leaderships or African governments, you can speak specifically to your local context in Kenya, how are they coming together to actually change the way we tackle these NTDs?
Just looking at what is happening right now, there's the whole idea around looking at health holistically as a public good. And with the current government in Kenya, we're seeing them focused more on health promotion and preventive care. And with this, we're seeing them looking at strengthening primary health care and deliberately focusing on how they're able to kind of sustain health financing by kind of taxing, those that are working and are higher up the economic chain to be able to ensure access to health services to the entire populace, ensuring health equity. And this is strengthened through social health insurance. So that is what is happening. And in as much as it's progressive because unemployment rate is still a bit high, not only in Kenya, but it's a challenge that most African governments are grappling with. But the shift that you're seeing in terms of looking at health as a public good in Kenya, and where those that are working are taxed more, similar to what the Obamacare used to do, so that they're able to ensure access to health services, for the marginalized population and at the primary healthcare level. I think the shift for me is something that is a bit interesting to see how then that can kind of build resilient primary healthcare systems where health promotion can be done, preventive health services, and for those that require curative health services can also still access health facilities at that level.
That's really encouraging that there is that work in the ground. And I want to ask further on this. What are some of the breakthrough stories or community success story that you have seen in your own work with AMREF that kind of gives you hope that something is working and the work that you do is having impact and meaning?
Thank you very much. So, impact is what I think all of us in the global health and public health space focus on, just trying to see whatever policies, whatever investments we have, how then does it create the impact at that lower level or at the individual or household level. And some of the successes we've seen is, for instance, a disease like elephantiasis that will kind of affect the males around the scrotal region. They'll develop a condition known as a hydrocele. And most of the time, people associate this to so many other factors. There are a lot of myths and misconceptions around it. They'll probably think it's, taking the local brew or witchcraft, etc. But over time, through constant engagement and community engagement, we've seen like males that have this condition coming out and seeking care and treatment, which is provided through a surgical intervention. And most of them are able to go back to their communities, go back to their families, reunite with their families, because some of them, because of their conditions, you could see families breaking, because some think the husband or their dad has been bewitched, and so they're running away from the witchcraft, not interfering with them. And so when a simple surgical procedure is done and their condition is restored to back to normal, and they reunite with their families. That is something that is very interesting. And you see them now, fighting stigma and being able to go back into their communities and engage in meaningful economic activities. And even some of them having more children, which, is something that they always think when you have a swollen scrotal region, then, you're unable to get children. So once we see some of those successful stories, those are some of the things that, kind of satisfy some of us that are in the business of addressing neglected tropical diseases within our respective communities.
That's absolutely brilliant. And it really, puts a smile on my face just listening to that story. So this really gives me so much hope. And I'm really excited that the work that you're doing is having such wonderful impact on the community. And, I wanted us to maybe then take it back to a broader context, right? As we're speaking on successes, we're fast approaching 2030 with the SDGs that some say we might not be able to meet the targets as it's pretty close. But for you personally, what does success look like for you in this field at a global level as we are linking it to the SDG goals, specifically for some of the health targets?
Just looking at the height of COVID around 2021, it appeared like 2030 was far off. But right now, we are mid into the current decade, and only 5 years to 2030. Yet COVID came at the beginning of the current decade, which disrupted various health systems, and beyond that, the economy, and there was a lot of disruptions. And we even saw countries that had the most developed public health systems, being vulnerable. And that raises the question, African countries that still have very fragile health systems, that still require a bit more of investment, what does that mean as we look towards the achieving the 2030 goals, the Millennium Development Goals, and the SDGs. And at the end of it, in the NTD space, we're working with a 2030 NTD Roadmap, where has various indicators to support countries to kind of eliminate various diseases. So from where I see it is, in as much as there are a lot of disruptions when it comes to in very strategic partnerships, because governments can never really walk alone. Even in the most developed nations, we still have the private sector, the non-governmental organizations always stepping in to kind of support or complement government efforts. And looking at African governments, we're really grappling with external debt, and there's an opportunity for debt concessions where we are able to discuss with maybe some of those external funders that African governments owe them a possibility of, can we go for debt for health swaps? And maybe, some of the repayments we're supposed to make, they allow us to reinvest that back into our public health system so that we can kind of improve the health of our populace. And if we invest in public health systems, make them robust and resilient, then I think 2030s, and as much as it's fast approaching, there is much we can still do within 5 years to accelerate, some of the targets. It's about moving the needle a bit more faster than, what we've been doing, so that, we, in as much as we're working in a challenging situation at the moment, but there's still hope. 5 years is such a short time, but still yet a long time if we double our efforts. It's not time to double down, but it's a time to double up and see how we're able to move the needle faster, invest more, build more, robust health systems, and at the same time, as governments do all this, have the communities at their mind, or rather at the center of, economic development, and looking at health indicators. How do they perform vis-a-vis economic development?
Yeah, no, that's absolutely so true, and we still remain optimistic that some of these challenges and the roadmap that you've clearly described, we can meet some of these targets with some of these wonderful interventions that you mentioned. Michael, as we are wrapping up, we've learned a lot. I've learned a lot rather, and I'm sure some of my listeners have learned a lot. I wanted to ask you, for our listeners who vary from young scientists to everyday citizens who might not be aware of NTDs, what advice on what simple but meaningful action can they possibly take to help end the neglect in that in the word neglect to tropical disease?
So in addressing the neglect in neglected tropical diseases, it requires a whole of society approach beyond the governments. And I think I've clearly outlined what governments can do, what strategic partnerships can do through, external partners. But at the same time, looking at researchers, looking at, young advocates, it's about ensuring the voices of the voiceless are elevated in the decision-making table. But primarily, the researchers, there's much that still needs to be done in the African continent to just understand these neglected tropical diseases better, develop better tools that can help to address the burden. And of course, as I had earlier mentioned, this requires strategic partnerships, looking at researchers and our friends the Friends of Africa globally, how can then we tap into their experiences, into the platforms and the systems within their, within their reach? How can we tap into them? Have young scientists, young researchers tap into them potential and their facilities to kind of develop tools and systems that are easily utilized or adopted here in Africa to kind of address the burden of neglected tropical diseases. And so this calls for very strategic partnerships, looking at the global north as our friends, not as our competitors, but at the same time, also the global north kind of supporting the young and upcoming researchers, trying to capacity build them. Transfer of skills, transfer of knowledge. For instance, a disease like visceral leishmaniasis, Africa, and especially East Africa, bears 70% of the burden. But, our drugs are manufactured and produced from the global north. The diagnostic kits are also not, produced here in Africa. And recently, the Africa Union launched the Africa Medical Agency. So how can then, using those platforms and opportunities, the Global South collaborate with the Global North to transfer skills? The Global North can also invest in Africa by ensuring that maybe diseases that are found in Africa, they produce, the drugs, the molecules, and the diagnostics from African continent. One, this will help to kind of address unemployment, lead to economic development, which over time will help reduce the burden of neglected tropical diseases. But at the same time, because these are private entities, they're still able to get their profits at the same time when empowering Africa. So I think what I'd call for is the scientists from the global north and the younger upcoming scientists get into very strategic collaborations, which can then contribute to addressing the burden of neglected tropical diseases, either be it diagnostic kits, drugs, epidemiology of the diseases, and just understanding the science of the disease a bit more. There is an opportunity for that.
1000% agree with that. The key thing that you've stressed in this conversation is the key strategic efforts in addressing this burden. And I hope even a conversation like this right now, is something that also brings awareness. And I thank you for your time. I thank you for your insights and expertise on this topic. Also, thank you for the work that you are doing with the organization, specifically in Kenya. And I truly hope that over time we can have positive results on how we are addressing this issue. And I am optimistic. I'm usually very optimistic, but I think with some
In
of
fact, maybe just one final thing to acknowledge, at least 56 countries globally have eliminated at least one neglected tropical disease. And in Africa, over 20 have done. So there are successes. So there's still hope that we can.
Yes. Oh, I love that. So there is reason to be optimistic. And I'm sure over time, with advancements in research and collaboration and funding and policy and government collaborations, this can be something that we can talk about in the past tense. Thank you so much, Michael, for coming onto the show once again. I really, really appreciate it.
Thank you very much for hosting me, Anne.
Okay, and to everybody else who's tuned in, thank you so much for listening to another episode of the Roots of Science podcast with your girl, and with an E. Until next time, goodbye.